Mergers and acquisitions, we see that happening everywhere these days. Hospitals acquiring other hospitals, health systems merging together with other health systems, even device companies, other areas of healthcare. We're seeing this happening more and more. Radiology, everyone knows somebody who's merging. And so how do we deal with that as leaders? Merging two separate organizations or one acquiring another. Let's talk to an expert about that. My name is Dr. Elsie Ko. I'm the founder and CEO of Lead Physician Online Leadership Program for Physicians, and also the Chief Medical Officer of American Endovascular and Amputation Prevention. Today, also go to our YouTube channel and check it out. Subscribe so you're notified for any future videos that come on. We're talking to Cydney Teal today, and she has a background in all of this. Let me introduce you to her. And she's one of the authors of this book that we're reviewing, the Chief Medical Officer's Essential Guidebook. Now, this book is great for any leaders, any providers in healthcare. You don't have to be a CMO. Maybe you're aspiring to be a CMO, or just any physician leader. Go to that book and find a lot of pearls on this. And let me just tell you a little bit about her. Her background is that Dr. Teal, she's dual certified as an internal medicine and family medicine physician, and she's held roles as a chief medical officer and really the first female and African-American president of the medical staff for Union Hospital for 7 years. And then she joined Christian Care Health System in 2019 as primary care service line leader and chair of the Department of Family and Community Medicine. And then, right now she's a CMO for Reciprocity Health, a health tech company, and is a co-founder and CEO of this company, this very interesting, I should ask her about this too, Delaware Health Equity Coalition, a nonprofit organization focused on addressing and eradicating healthcare disparities in marginalized community. Talk about a lot of things going on with her. So this is her chapter, the CMO and the organization. If you get this book, Understanding and Navigating the Environment. So let's bring her on board here. Cydney, thank you so much for being here. Appreciate it.
Hi, thanks so much, Elsie. I appreciate the opportunity.
Yeah, so tell us a little bit about, why you wrote this chapter. It sounds like you've had ups and downs and a lot of learnings from your positions.
Sure. Thanks for, again, the opportunity. So, my learning, it was interesting when I was thinking about a chapter and speaking with Mark Olsick about this, I thought about, where's an area that not all of us have an opportunity to experience, good, bad, or indifferent, and an area where I thought, we as chief medical officers, or as you said, aspiring chief medical officers, medical leaders, really should lean in on. And as you shared, mergers and acquisitions are happening more and more frequently, especially in healthcare, and understanding sort of the dynamics and what we need to be doing as chief medical officers, how to prepare for this journey is really essential. So that's where it led me to say that this was the chapter that I wanted to write.
Yeah, let's get to the heart of it. I want to know, what was the steepest part of it, and what do you think about the merger or acquisition of one for another? Do providers need to know?
Sure. So I will tell you the greatest challenge comes long before the announcement that you see in social media or in the paper, and you see the ribbon cutting or what have you that's happening. Really, there's so much that goes on behind the scenes, the background, the work that has to be done that often starts up to a year, if not more, before that actually occurs. I can recall in our situation.
That's a long time.
I know. I can recall in our situation, and I think I shared this in my chapter. Our organization was really sort of taking a pulse of our financial status, looking around in the community and looking around in the environment, and really identifying as a small independent health system, how long could we stay in this position? And at that time, we were in really a strong position economically, financially. And so I can recall having one of the consultants come in. We often will say, okay, consultants, I don't know if they necessarily give us a lot of really good content, but I remember our consultant said, sort of drawing a continuum and saying, when you're in a position of strength, this is the time to be thinking about what does it look like to have a partner? What does it look like to merge? What does it look like to be acquired? And it really is a continuum. It's really understanding that continuum, that as you lose your financial status or your stability, you go from having what could be a partnership to being more like a merger. I'm going to say worst case scenario is an acquisition. So I would say that the steepest part is really understanding the financial health and the well-being of your organization long before you get to the place of hearing the whisper down the lane in the medical staff office, or you're sitting at your executive meeting and suddenly you're having a conversation about meeting with different hospital or health systems.
Yeah, let's talk about that, because you do go through some key learnings of enterprise integration in your chapter, and again, get the guidebook so you can understand a little bit more. But the first one and what you're talking about right now is follow the numbers. You're talking about financial health. How am I supposed to, as a physician, understand the financial health of an organization? I didn't get an MBA, or I didn't, I've never done this before. Where do I start?
Sure. So, my recommendation, and as you said, I do have an MBA now, but I did not have one at the time when this, my life was transforming before my eyes as we were going through this journey as a health system. It really is to get close to the chief financial officer. It really is important to understand, sit down shoulder to shoulder and walk through the balance sheet and understand the financial health of this health system, understand short-term status as well as the long-term status, how many days of cash on hand. I mean, just some very basic things that you should know about the economic stability of the organization. So I think that's the number one thing that you need to be able to do. It's to understand the trends, understand where there are opportunities as a chief medical officer to do your part to, really enhance revenue if you're in a situation where you can enhance revenue, cut costs where you can cut costs, long before the CFO is coming to you and saying, I need you to start cutting costs. So
awesome, because it is the provider who understands where we can cut, instead of allowing somebody else who doesn't understand the clinical part to cut it when something you desperately need is being cut. Be the one to help them know what is the low-hanging fruit that we can go for first.
That's exactly right. And to be more and to anticipate that, as opposed to, again, waiting for someone to come to, waiting for that CFO to come to you to say, I need you to cut your budget. That's exactly right.
Okay, great. And number 2, you said share openly and continuously. Can you talk about that?
Sure, absolutely. This is probably one of the greatest challenges that we all have. Well, there actually 2 greatest challenges, and I'll talk about that one next. But this is where, you have to be able to translate the same way that you're translating to the financial officer and to your other C-suite colleagues about your position, what's happening in the clinical realm, and being able to translate it in a way that they can comprehend. And so that you're able to get your initiatives passed through. It's really important to be able to translate what is happening at the executive level to the medical staff and the clinical staff at large. They need to understand the health and the welfare of the organization. They need to understand that when you are making cuts, and if you are cutting programming, why that's happening. Don't be afraid to show them the numbers. I think it's important. In my instance, we had a monthly medical staff meeting. And, this was pre-pandemic. So, we had a room full of 60, 70, most of them were physician staff that understood that we were going to talk about the financial health and the well-being of the organization, because we thought it was important that when decisions were being made, and big decisions were going to be made for the organization, that they were in the know and wouldn't say, I didn't know, I wasn't invited to the table. Right. Really, really important to do that. And it may be painful, but you have to do it.
Yeah, I can imagine there's some pain there. Can you talk a little bit about that? What were the pain points?
The greatest pain points were really when clinical programs were being cut. It goes along with the continuum of being in a management services agreement to considering merger to actual acquisition. As your financial position, your strength starts to weaken, there are certain places there that the CFO is going to go first to ensure that that we are able to have a little bit of a margin, or hope to preserve that margin. And that will usually look at these sort of, I want to call them the extended programs, or clinical programs, community-based programs, things that may be in the wheelhouse of the chief medical officer or chief clinical officer, sometimes in the wheelhouse of the chief nursing officer. So those are the ones that will go first, but those are the ones that many of our clinicians will be very passionate about. And so to stand in front of a room of people, or at this point, you're getting on Zoom and you're having these conversations, no one wants to hear about programs that have been successful being cut because it doesn't seem to make a lot of sense. And that's why, as I said, laying the ground, and it's not always successful. Don't get me wrong. I don't want to suggest that every time I sort of laid out the picture, everyone's like, oh yes, Cydney, we totally understand why you're going to do that. It
takes a lot of guts, though, I have to say.
It does. I'll tell you what, you wear your Teflon vest and you go. You have to do what you have to do. But it does help to understand, it helps, I think, the broader, just not just the medical staff, but the greater community to understand the rationale behind the decision-making that's happening. It's not without regard or understanding that these are important programs. It really is to understand that we're trying to preserve, some fundamental components of the organization, like nursing staff, clinical staff, things like this. So that's the hard part.
Great, thank you for sharing that. And the last thing that you said was, and again, another pain point, another tough thing as a physician leader: be prepared to accept change and loss of control.
Yes. So again, speaking to that continuum, when you're in a position of strength as an organization and you're making partnerships, there's usually an opportunity to reevaluate, reimagine what your position or your span of control can look like. But as I said, as that starts to change, as the system is now looking and in our instance is a little bit more, maybe desperate's a strong word, but there's a level of urgency to be able to stop the bleed, the economic bleed and economic loss. That you're going to now either be, merged with someone or be acquired. And in those conversations, I will tell you, Elsie, it was difficult because you're sitting there having a conversation and you're hearing about the other chief medical officers and the other organizations and how they may be chief medical officers over multiple hospitals. And suddenly you're sitting there thinking, or at least I was thinking, I may not have a job as a chief medical officer. This is not a job. And I think most of us know this is not a job for the feeble-minded. And you really have to understand that your role in that moment is to ensure the solvency of your organization. And so you sort of put that aside, and in your mind, you think that, hopefully there'll be a role for me in once this transition occurs. And so I think that is the hardest part, is recognizing that you may not be in that position for the long haul. You may be part of, I call it the transition team, like you transition the organization to a new parent organization, and then you will be faded out. And so that's really hard to think about, as we as physicians often, we commit for long periods of time because it takes so long for licensure. And in your part,
it's unusual for physicians to think that they would ever be fired. Or
that is exactly right. But I will tell you that I certainly have known and have I've hired people who have been fired because of acquisitions. And so it is very much real. And then the harder part is that you have to be able to maintain your composure as you're telling the rest of the medical staff and the clinical teams that this transition is going to happen. And, they're asking you, what's going to happen to your role? And you have to be able to look them in the eye with a straight face and speak with not just authority, but you have to speak with a level of authenticity that says, I don't know. I'm hopeful that there'll be a space for me. I hope that there'll be a role for me, but the focus right now is to make sure that we have an organization and a hospital that our community can continue to come to seek their services. And that was the most, I think,
right.
Of the
and
three
it's not just maintaining a composure outside, it's maintaining it within.
That's
so
right.
that you yourself can continue on doing what you need to do, and also being that a leader who other physicians who might be reporting to you can lean on, because everyone else is experiencing change too. So making change easy for everybody else. I think that's a wonderful point. Thank you so much. So if people, thank you for doing this podcast. If people have any questions or want to reach out to you, how can they reach out to you?
Sure, they can reach out to me through my my personal email that you have on the screen there, cteal1732@gmail.com. I would love to speak about my experiences, my experiences since then, and help anyone through a tough time, because being a CMO is not an easy job, but it's incredibly rewarding.
Yes, also, we need more CMOs out there too. If you're interested in buying the book that we discussed, go to bit.ly/CMO Guidebook. Again, my name is Dr. Elsie Coe. If you have a topic on physician leadership, please reach out to me at info@drelsiecoe.com. And if you're interested in leadership training, check our website at leadphysician.org. Any last words for us? And I want to highlight also that this Delaware Health Equity Coalition. Any last words for us? And if you want to talk a little bit about that, that'd be great.
Sure. I mean, I think my true last words are those of inspiration. It's been an incredible and immense journey. Much of it has been challenging, but with challenge comes perseverance and resilience. And I've learned so much. And truly, my role as the Chief Medical Officer has really been able to give me I think the tools in the toolbox to begin our nonprofit medical practice, that is Delaware Health Equity Coalition, taking care of medically underrepresented groups of people. We do it in the city of Wilmington, and we're just getting started. So we're very excited about the work we're doing, and more work to come for sure.
Wow, thank you so much. Thank you everybody for watching. Until next time.